Welcome to Childcare Licensing's Independent Training Series. This training is an additional required topic. My name is Kat Martinez, and I'm a trainer in childcare licensing, and this training is about 5 minutes long. This section is Preventing Shaken Baby Syndrome, Abusive Head Trauma, and Coping with Crying Babies. First off, what is shaken baby syndrome or abusive head trauma? It's a term used to describe the constellation of signs and symptoms resulting from violent shaking or shaking and impacting of the head of an infant or small child. Causes: babies have weak neck muscles and often struggle to support their heavy heads. If forcefully shaken, their fragile brain moves back and forth inside the skull, causing bruising, swelling, and bleeding. Shaken baby syndrome usually occurs when a parent or caregiver severely shakes a baby or toddler due to frustration or anger, often because the child won't stop crying. Shaken baby syndrome is not caused by gently tossing a baby during play, bouncing a baby on your knee, a fall off of a couch, jogging, or bicycling. Complications: even brief shaking of an infant can cause irreversible brain damage. Many children affected by shaken baby syndrome die. Survivors of shaken baby syndrome may require lifelong medical care for conditions such as partial or total blindness, developmental delays, learning problems or behavior issues, intellectual disabilities, seizure disorders, or cerebral palsy. Symptoms or signs that a child may have been shaken include extreme fussiness or irritability, difficulty staying awake, eyes rolling back into head, breathing problems, poor eating, vomiting, pale or bluish skin, seizures, paralysis, or coma. Risk factors: the following things may make parents or caregivers more likely to forcefully shake a baby and cause shaken baby syndrome. Unrealistic expectations of babies, young or single parenthood, stress, domestic violence, alcohol or substance abuse, unstable family situations, depression, or a history of mistreatment as a child. When to see a doctor: seek immediate help if you suspect a child has been injured by violent shaking. Contact the child's doctor or take the child to the nearest emergency room. Getting medical care right away may save the child's life or prevent serious health problems. Coping with crying babies. First, make sure their physical needs are met. That's checking their diaper, adjust clothing if they're too hot or too cold, feed them, offer comfort. Check for anything causing discomfort, such as a tag, ill-fitting clothing, or a hair tourniquet around a finger or toe. If there is someone else available, have them take over for a while. Place them in a safe place, like a crib, while you take a minute to yourself. Take some deep breaths, or call and talk to someone if possible. Call the parents. Keep parents informed if their child is crying excessively. They may need medical attention, or the parent may be able to offer helpful advice. Remember, crying is meant to be an irritating sound. Don't take it personally. A crying child does not mean you aren't a good caregiver. And everyone gets frustrated. Be aware of your frustration level and have coping strategies in place ahead of time. Thank you for completing this online training. If you have further questions, please reach out to Kat Martinez or Charlotte Woodward, and have a great day.